Welcome back. Well, let's start talking about one of the key problems for obesity in India, which is basically our diet. Dr. Deshpande, the crux of our problem is probably our diet. Statistics show that 51% of students eat junk food, 38% of adult Indians eat poorly. So what is wrong with our diet to that extent? Is it the lack of protein? Is it too much carbohydrates? Or is it the incremental amount of junk food that our diet has, turned towards in the past couple of years?
Right. So yes, you're very right. The problem is calorie excess because of abundance of food. The other problem is carbohydrate excess. And the third is protein deficiency. So all these three put together are a recipe for disaster because you are increasing your calories, which is going to make you fat and obese. And you are increasing your carbohydrate intake with all the junk food that is there. And you're also increasing your fat content. And all of this is ultimately going to lead to a lot of insulin resistance, fatty liver, and this is inviting all the metabolic diseases that are associated with obesity. So junk food is very high on processing, and processing is really bad because it can cause a lot of what we call oxidative damage.
What is a good source of vegetarian protein according to you, Dr. Deshpande, and how much protein should one consume?
Yeah, so typically, if you're really very active, the formula is that you should get 1 gram per kg of your body weight. But if you're not very physically active, if you're much older, you can go to 0.8 grams per kg body weight. If you talk about vegetarian sources, there is no complete protein. So you will have to eat multiple sources of protein because all the amino acids are not contained in any single food. So vegetarian protein is basically not a complete protein. So you'll have to make a mix and match of different things like cereals, sprouts, maybe paneer, dairy, basically. So mushrooms. So these are all the ways that you can get proteins, but not one of them is a complete protein. So one has to be very vigilant. It's not a way, you have to be really careful where your protein is coming from, and maybe meet up with a dietitian to actually find out where the protein is coming from in your food. So it's not very easy to get all the protein that you need from vegetarian sources. But mushrooms, dairy, all these are very few sources are there of protein. Sprouts do have protein, but they also have a lot of carbs, which people don't understand. Everyone thinks that sprouts is full of proteins. It has protein, but it also has a lot of carbs. And ultimately, if you had to get all your protein from the natural vegetarian sources, your calorie count is going to increase exponentially. So, so that is what you have to be careful about.
Would you recommend weight loss surgeries, or is lifestyle enough to probably reduce the weight? How does it work when a person is obese?
So there are very, very specific criteria for weight loss surgeries. And by weight loss surgeries, I don't mean cosmetic surgeries like liposuction, tummy tucks. I mean bariatric surgeries or metabolic surgeries. So once your BMI is above 37.5 and you're Indian, then there is a recommendation that you could consider surgery. If your BMI is above 32.5 and you've got diabetes, which is worsening, you've got kidney failure, which is coming up because of diabetes, or sleep apnea, or your hypertension gets much worse, you're not getting control, you've taken one drug after the other and still not getting control, then you should consider surgery. But otherwise, bariatric surgery should be remained and recommended only to those people who've tried everything else, multiple diets and exercise and failed it, or some of the newer drugs which are available, unless you're above a BMI of, let's say, 50. Because then nothing else is going to work. And you rather get the life-saving surgery than go down a path of trying various options and getting much worse with disease.
Okay, all right. What are the risks to these weight loss surgeries? Because you hear, stray complications of weight loss or bariatric surgeries. You hear of fatalities as well.
So any surgery is accompanied with a risk, right? It depends on what risk it is. Today, in best of centers across the world, bariatric surgery comes with a less than 0.1% risk. That is associated with childbirth, that is associated with hernia, hysterectomies, gallbladders. And remember, this is a risk population group of people with hypertension, sleep apnea, diabetes. You throw everything into one box And the only Ramban Shastra, as I call it, to treat all these diseases probably is bariatric surgery.
It's probably bariatric. Okay, all right. Well, Dr. Deshpande, you know, the new alternative which has come out for weight loss is basically the weight loss drugs, semaglutide tablets by Novo Nordisk. The oral form is available in India. How helpful is it when it comes to weight loss? How revolutionary is it to treat obesity?
Yeah. So the oral semaglutide is revolutionary in the sense that a peptide molecule has been put in the form of a pill, and this is the first time ever any peptide has come in a pill. As far as oral semaglutide is concerned, the dose that is available now the world over is actually meant to treat diabetes, and it does cause weight loss, but not the amount of weight loss that would accrue from the anti-obesity dose of semaglutide, which is injectable. So Wegovy is the drug that is actually licensed for use even in India, but not available for obesity. So you need higher doses of the same GLP-1 agonist for weight loss than for anti-diabetes effects. So yes, it does cause weight loss. And at the moment, it is licensed for use in India, the oral one only for diabetes.
Okay, all right. But what are the side effects of these weight loss drugs, Dr. Deshpande? You know, they've been linked to a rare eye condition which can probably cause vision loss. There is a debate on mental health implications of it as well, and whether it, you know, actually helps in terms of dementia, and whether it does, you know, causes suicidal tendencies as well. So the debate is really out there on terms of the side effects of weight loss drugs. What would you recommend?
Yeah, so the short-term weight loss, the short-term side effects that are there, well, yes, everyone knows them, it's accepted. They're gastrointestinal, and that actually is expected. However, the other things that you talk about, the rare eye condition, the suicidal tendencies, the depression, or whatever it is, all of these are few and far between. And any drug that comes into the market is well researched. Nowadays, we have huge numbers of patients who have actually taken the drug. There are huge clinical trials. So when a drug is approved by the regulatory bodies, it means that the risk benefit ratio has been calculated, which means to say that the benefits far outweigh the risks of these rare conditions for which there is a warning, we know about it, and we are vigilant about it. So as such, I would not preclude the use of these drugs just based on these small and rare side effects. The benefits that are there to the population are far more than these.
Okay, all right. Who do you then, Dr. Deshpande, recommend it to, and what happens when you stop using those drugs? Do you put the weight back on?
Yes. So to answer your second question first, whenever you stop taking any drug, whether it's diabetes, blood pressure, or it is weight loss, if you stop taking the drug, it's not going to act, and that's very, very obvious. Having said that, once a person starts taking this drug, today there is no recommendation of when to stop it. So for all practical purposes, we just say that it has to be taken long term. But once a person gets lighter, we hope and expect that that person starts to do more physical activity, and there could be a way in the future where we could start actually de-prescribing or de-escalating at least the doses of these particular drugs. But as of now, they have to be taken long term for the effect to last.
Okay, all right. And lastly, Dr. Mufi, you know, weight loss drugs, do you think that it'll replace the weight loss surgery market?
You know, a lot of people tell me, have your surgery numbers gone down? Actually, frankly speaking, they've actually gone up, contrary, if at all, or maintained the same level rather than going down. Because what the drugs have done has got obesity onto the talking platforms. Today, sitting in the newsroom, we are talking about obesity. It's brought obesity out as a disease, which was hitherto hidden, and people spoke only quietly in social circles and sniggered at someone who was obese. But today, people are realizing anybody who loses even 10% of their total body weight, or 15%, these drugs promise between 15 to 20% of total body weight loss, knows the benefits that they get. Let's say whatever happens, let's say a side effect, or they can't afford the drug, or they stop it for some reason, and that weight rebounds, they realize the importance of weight loss and what they could do when they had lost all that weight. And that's brought people with obesity out onto the platform and saying, now we want to look for an option. We no longer want to run away from this question. So I think it's done a good thing for us.
Okay, all right, Dr. Mufi as well as Dr. Deshpande. It's been a conversation which I think needs many questions more, but we've completely run out of time. Thank you very much for joining in and speaking to us on the Medicine Box. Thanks very much.
Thank you so much.